How do we recognize whether there is asphyxia or not? I mentioned the example where a fetus may have a brain injury due to other factors and actually may not have asphyxia, but the baby doesn't respond well after delivery because of the underlying brain condition. So the correlative signs of asphyxia become important to differentiate a baby who had a pre-existing brain injury from a baby who is having brain injury during labor. It's not very easy to recognize that, but it's important to try and differentiate. So we may have meconium stained liquor, which may be a sign of fetal distress, where the vagal tone drops and the sphincter relaxes, the meconium may be passed. However, most of the meconium stained liquor happens in the post-term babies where there may not be any asphyxia. It's not a good correlate. The Apgar scores, as we will see, is not a very good correlate either, because it's a response of the baby to the resuscitation more than the underlying fetal symptoms. However, a prolonged or a high a low of a 10-minute Apgar score is quite correlative of brain injury. The fetal and neonatal blood gas levels are important as well. Fetal heart monitoring changes. Again, it needs to be interpreted with caution. The neonatal neurologic syndrome and the occurrence of seizures are clear features that the brain has injury, but whether it's asphyxia that caused the injury depends on the other factors that are associated, the sentinel event or any of these abnormalities. Multi-organ dysfunction would go more with prolonged partial asphyxia that would correlate with asphyxia as well. And EEG and neuroimaging findings, even though not specific, it may guide you in the right direction, because if you have diffusion-weighted changes like infarction in a brain which is otherwise normally formed, it may be fitting with asphyxia. The key reasons we look at these very closely is their medico-legal implications. As I said, once a baby has cerebral palsy, you want to see whether there was any association at birth which would suggest there was asphyxia or mismanagement during labor, and that's when these factors become important.